And our show today is treatment options. New York versus Florida. New York, 3-4 days for detox. It's usually a 7 to 10 day process. And rehab, the 28-day rehab, they might get a week. But in Florida, a lot of people are coming to Florida for treatment. They're getting longer stays. So can you tell us what's going on down in Florida versus New York?
I think that there are different rules and parameters, state to state, per insurance companies. In Florida, we're having a tremendous amount of success with keeping our patients longer. We also do have additional ways that we can bill in
and
Florida.
I think that's it also. That's
that
a big,
they don't have here as
piece.
well.
It really comes down to licensure. For our facility in particular, we're able to offer a full continuum of care, so that's residential, partial, and ILP. So being able to offer all that under one roof, it allows us to keep somebody and get them covered through their insurance for longer lengths of stay. There's people that come from all over the country to recover in Florida, and it really has been established, and there's people that have been down there for a long time in recovery, and so it creates a very good community and fertile ground for growth.
We are a campus-based inpatient substance abuse treatment program. All treatment takes place on a 15-acre campus. At Lakeview, we actually have in-network and out-of-network. We have 2 facilities. That way we don't have to differentiate between in-network and out-of-network providers.
So, one of the beautiful things also about South Florida, where HARP is located, is the amount of sober living that's around. So, unfortunately, in New York, it's a big problem. There's a lot of push from facilities like ours to really get some stuff in motion up here. In Florida, they have these houses and entire condominium complexes at times that are structured living, where they're held accountable. They have to take drug tests. They're expected to cook. They're expected to work. At the end of the day, what we're looking for is to keep somebody in a structured living environment for as long as possible, because after a year of sobriety, the chances of somebody's sobriety, their success rate goes up about 70%. There's actually clubhouses that will hold meetings too, and people can hang out there in their spare time and really just kind of socialize, and that's a big part of it too, is really establishing meaningful connections with other people.
And people can't come get clean and have nowhere to go. I mean, it's just, you can't just put them back in society. That's why it's like a revolving door, and insurance companies don't want to pay it anymore because they paid for it so many times already.
To put somebody in treatment for 2 weeks and expect any result, it's just not going to happen. There's no cure. So when somebody comes into treatment, it's of vital importance to make sure when they leave that they have somewhere to go. When we come into treatment, we're taught that we have to start living an honest life, that we have to start forgiving other people, that we have to start forgiving ourselves. All this stuff, for a lot of people, it's too much to take on. Eventually, somebody will fall into some old behavior patterns that are more comfortable and end up relapsing. And it usually starts with something very small. It's just, no matter what it is, if you're doing something that's dishonest, falling back into those old patterns, those old ways of thinking, it's only a matter of time before you end up, back doing the same things.
Everyone at Lakeview currently is licensed or at least CAP certified, which would be the same as a CASAC.
Do your organizations do medication-assisted treatment?
So Suboxone, is that?
Or Vivitrol?
Vivitrol, yes. Suboxone, no.
We also do full medically assisted treatment. We have a full medically assisted detox protocol. We do full psychiatric assessments on patients, so we do psychiatric medically assisted treatment as well.
You know what? I think New York can learn a lot from Florida, and I think we are.